mind that blood glucose, the higher it goes and the body does not know what to do with it, it will convert it to fat. And if your baby is converting high levels of glucose to fat, then your baby is going to gain weight faster than the typical baby. Hello moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi and it's definitely a pleasure to be with you all today. If this is your first time here, you are most welcome. Today I am going to be discussing gestational diabetes mellitus, or just simply known as pregnancy diabetes. If you have not done so already, make sure you hit the subscribe button and turn on your notification bell, because that is how you are made aware of every time I upload a video. Now, what exactly is gestational diabetes mellitus? Simply put, it is diabetes that a woman deals with when she is pregnant. Gestational diabetes happens because when a woman becomes pregnant, the placenta that connects her to her baby begins to secrete hormones that tells the body to make more glucose because it's growing a baby. And unfortunately, when a woman's body makes more glucose, then her pancreas, which is the organ that tries to regulate blood sugar, will also release insulin to try to bring that blood sugar level back down. The placenta makes hormones that resist insulin so that the baby can get blood sugar. And what happens is the baby's blood sugar goes up, but mom's high blood sugar does not respond as it should. So her blood sugar is also high because she's trying to feed her baby, and her blood insulin is high because she's trying to get her blood sugar down. Now, some women can adequately manage this high blood sugar, high insulin situation, but for the unfortunate few, or the 10% that deal with GDM, gestational diabetes, this is not the case. Their body needs a little bit more to regulate that blood sugar. So what are some of the signs and symptoms that a woman can experience to let her know that she is dealing with gestational diabetes? Well, before I tell you that, I'm going to let you know that diabetes is very damaging to blood vessels and to nerve endings. So a woman needs to be very conscious if she starts to deal with tinglings in her arms, in her hands and fingers, or in her toes. Make sure you let your doctor know if you deal with those. Some of the other signs and symptoms that a mom can notice is that she tires very easily, and it's a fatigue that is more tired than the typical pregnant tired. Sometimes a woman will be very thirsty and she will urinate a lot because she's drinking more. You can deal with blurred vision. So if you're having a hard time seeing, and you didn't have a hard time seeing before you got pregnant, you definitely want to call that out to your doctor. Women who deal with gestational diabetes also have an increased number of vaginal and bladder infection than the typical pregnant woman. And because the blood sugar is really high, the body will begin to retain fluids, which can cause the blood pressure to also go up. For moms who deal with gestational diabetes, they run the risk of having big babies, which increases the chances that they will need a C-section to deliver. Now, a woman is typically not checked for gestational diabetes until she's between 24 and 28 weeks pregnant. So if you notice these signs before you get to that point, make sure you let your healthcare provider know. Moms who have poorly controlled gestational diabetes can suffer from stillbirth, they can suffer from miscarriages, and a lot of times they give birth a lot sooner than they should, so they end up with preterm deliveries. For your baby, like I said, babies run the chance of being a lot bigger than the typical baby for their gestational age. Keep in mind that blood glucose, the higher it goes and the body does not know what to do with it, it will convert it to fat. And if your baby is converting high levels of glucose to fat, and your baby is going to gain weight faster than the typical baby in the womb should gain weight, this is why moms need to deliver by C-section, because it's not going to be an easy delivery for her to deliver a large baby, also known as macrosomia, the vaginal way. Babies can also deal with very low blood sugar when they are born. And for moms whose blood sugars are not well controlled, the baby can pass away. So it's very important for gestational diabetes to be addressed. Another thing that babies can deal with is breathing difficulties. It's very hard for a child who has a lot of weight on it to be able to expand its lungs effectively. And you as a baby comes newly into the world, it has a lot of things to learn. Diabetes just compounds that in a way that the baby should not have to deal with. So keep those things in mind. If you see these symptoms, reach out to your doctor and make sure it gets treated on time. So who exactly is at risk for gestational diabetes? Well, right off the bat, obese or overweight women are more at risk than their skinnier counterparts. But skinny women can get it too because GDM is a hormonal issue. So if your hormones are poorly controlled in pregnancy, there's a chance that you can deal with it. Another thing is that if you have been pregnant before and you had gestational diabetes, there's a chance that in your subsequent pregnancies, you can also deal with it. Also, women who have a family history of diabetes are also at increased risk, and the risk is even higher if your mother had diabetes in her pregnancies. And a woman who has diabetes before she gets pregnant also has an increased risk of it being superimposed on her while she is pregnant with her baby. So keep it in mind and make sure that your diabetes is controlled if you suffer from it, or that you maintain a healthy weight. Know your family history just so that you can take the necessary precautionary steps to protect yourself and your future babies or your current pregnancy. Now, with gestational diabetes, prevention is better than cure. So before a woman gets pregnant, it's important for her to make sure she maintains a healthy weight. And you do this by eating a healthy diet, making sure that you are exercising 3 to 5 times a week, and that the exercises you're doing are aerobic or cardio exercises, so that you are making sure that you are burning off all the calories that you do not need. Also, make sure that you are getting enough sleep during the day and that you minimize stress. Stress causes your body to secrete a hormone known as cortisol. Cortisol stimulates your body cells to begin to break down glucose, and that glucose rushes into your bloodstream, causing your blood sugar to rise up. If you minimize stress, you minimize your body's need for glucose and can adequately control the onset of diabetes in your body. Now, even after doing all of these steps to make sure that you are healthy, there's still a chance, because like I said, diabetes has a hormonal factor, and there's no telling how your baby's placenta will interact with your body. Keep doing the things that have been previously recommended, but on top of it, if you do deal with gestational diabetes, you are going to need to monitor your blood sugar daily. And if your blood sugar is too high to where monitoring it and diet and exercise changes cannot effectively control it, then your doctor may need to prescribe some medication to help you reel it in. Know that gestational diabetes ends once your pregnancy ends, and that is good news. However, a woman who deals with gestational diabetes runs a chance of developing diabetes later in life. So if you deal with that, make sure you take additional steps to stay healthy. Get your annual checkups to make sure that your blood sugar, your A1C stays in a favorable range. I want as many women out there as healthy as possible, so make sure that you are having a dialogue with your doctor to make sure that your risk factors are properly managed. I wish you a safe, healthy, and happy pregnancy. If you have not done so already, make sure you hit the subscribe button, turn on your notification bell, share this video with somebody you know needs to hear about it, and join this community of learners who are actively advocating for their health. I wish you all the best, and until the next video, have a great one.